Ciao mondo, hello world, hola mundo, hello monde, konnichiwa, ni hao, namaste. We're here today with Dr. Anna Giuliani from our PD center in Vicenza, Italy, connected of course with the International Renal Research Institute, and we're discussing after our PD course about the cycler from Fresenius Medical Care, which is called
Sleep Safe Harmony.
Sleep Safe Harmony. The name suggests something like calm and relaxing treatment at home. So can you comment on the characteristics of this machine?
Yes, good morning world, good morning prof. The main characteristic of this machine is the number of prescriptions that you can do it with this, and particularly the use of breakpoint technology, which is now called FlexPoint, which allowed to reduce the number of alarms during the draining phase according to the transition point of the catheter.
So in other words, what you're saying is that this machine is able to recognize by pressure or by flow the moment in which the last 20% of the fluid would take a long time to empty the abdomen, so there is no point to continue and lose time, and the machine what does? Start recharging.
Yeah, to fill the abdomen again. Yes, this means that every cycle the machine can change the point of the drainage at which it starts to fill again the abdomen, and this reduce the number of alarms and allow a sleep safe.
So this is a kind of tidal strategy that the machine takes on its own, right?
Yes, it's a variable tidal each cycles. And then with this machine you can profile each cycle according to concentration of glucose, according to duration of the duration of
treatment.
Yes, of the dual, sorry, and according to the field volume. And in this way you can...
And you do this at the machine, or do you do with the computer?
You do here when you, for example, put 4 cycles, you can profile volume, concentration of glucose, and duration of the dual. And the same with this program, you can use the adapted prescription, which has a standard module with 2 low volume and 3 high volume cycle. But if you want, it's like that, 2 low volume and 3 high volume treatment.
But when you say you are prescribing this on the computer, how do you transfer the prescription to the machine?
Yes, you still need the card to register the prescription on the card and then put the card in the machine. The patient then, after the end of the treatment, move the card from the machine to the card reader, and this allows us to control his treatment. This has to be done every day, but in this way we can make a secure connection with the patient home and control his treatment.
So the advantage is that you can modify the prescription?
Yes, if we put the card in the card reader, we can start a connection through VPN connection and modify its treatment if we need to do it.
So this virtual private network is actually the solution to many problems that before we were having with the telephone or asking the patient to come to the department and bring the card. And now they don't need to bring the card anymore. Basically, it's like to follow the patient at home every day.
Yes.
So this has been an incredible evolution of cyclers. If we consider the very first cyclers that we had available, in particular for Fresenius, we had the PD Night and then the original Sleep Safe and so on. But the question that today we have is How much is the patient enjoying this level of freedom from the center? Is the patient somehow happy to avoid to come to the center?
Yes, of course. They believe that we can follow them more frequently, avoiding him to come in the hospital. So they totally agree with this kind of new type of medicine.
Yeah, and I would like to remind that in our center we're following approximately 130 patients on peritoneal dialysis, which means approximately 42% of the overall treated population with renal replacement therapy. So we are strong PD believers,
Yes.
I would say. But again, today peritoneal dialysis is not anymore a second-class treatment. It is a treatment that allows patients to stay at home and to be really dehospitalized. We had the special advantage recently in the occasion of COVID-19, right?
Yes. We were forced to dehospitalize patients, keeping them home, and this kind of telemedicine or two-way communication allow us to continue to control patients at home, guaranteeing them the full care as they come in the hospital as well.
And keeping the patient in harmony with sleep safe,
Yes.
correct?
Right.
So thank you very much for joining today Cappuccino from Vicenza, Italy, and our International Renal Research Institute of Vicenza. Excellent.
Right.
Excellent.